millions of people already collect health data from their watches and phones. The missing layer is turning scattered signals into organized evidence and better questions for a clinician. Sihha helped me connect jogging heart rate observations with longitudinal LDL trends and prepare for a cardiology review, without pretending to diagnose me. I am preparing to book that evaluation and ask whether a resting ECG and exercise ECG are appropriate. This is how Sihha works. The public contest edition recreates that workflow with synthetic records and a complete English interface. It preserves Sihha's 7-part experience, trends, upcoming tests, protocol, supplements, medical profile, labs, and activity. An Apple Health export zip stays in browser memory. Sihha extracts export XML locally, parses steps, sleep, resting heart rate, exercise minutes, and workouts, then normalizes the latest 7 days into one React dataset. That state immediately drives 8 activity charts. There is no upload, account, database, telemetry, or API key. The evidence engine then places wearable observations beside lab trends. In the synthetic demo, a jogging heart rate peak and an LDL result above the displayed sample reference create a prompt for a cardiology conversation, not a diagnosis. The brief separates evidence from inference, shows the explainable rule, and prepares questions about a resting ECG, exercise ECG, safe intensity, ambulatory monitoring, and lipid context. It never classifies rhythm, decides whether the user should stop exercise, or recommends treatment changes. Qualified clinicians decide testing, diagnosis, and treatment. Codex powered by GPT-5.6 did more than write screen copy. It isolated the contest edition, structured the repository into the Apple Health importer, evidence engine, React interface, synthetic samples, documentation, and tests. It helped design the cross-signal rule, define the privacy and non-diagnostic boundaries, and connect the import flow to the visible product. The implementation path is traceable. Import local health file extracts the XML. Parse Apple Health XML normalizes the daily signals. Build Health Summary computes trends and priorities. React State then renders the cards, 8 charts, cardiology prompt, and the same structured evidence used by the clinician brief. Privacy was tested, not assumed. Automated checks confirm that the repository contains no private medical source artifacts, the importer includes no network request, the synthetic zip fixture and report assets are shipped, and the rendered product plus English interface contract are present. The current production build passes 4 tests with 0 failures. Sihha adds the missing layer between collected data and a clinical conversation, organized evidence, transparent limits, and better questions. It is not a diagnosis. The user chooses what to share, and the clinician remains responsible for evaluation and care.